There's definitely a problem. I think it's more with insurances and things like that. It's kind of a whole scale problem. It's not necessarily just the healthcare system. There's a bunch of problems and a lot of aspects that go into running a hospital or a clinic or wherever you would go to get your health checked up on.
TikTok is a social media platform in which users can create short-form mobile videos and upload them for other users to view. Nurses have been using the platform to upload videos concerning areas of their career. One TikTok posted on Twitter by a nurse in November of 2019 depicts her disbelief in a patient who is showing shortness of breath. This video and others of the same nature received backlash and sparked discussion about distrust in the healthcare system. One Twitter user pointed out the high maternal death rate of Black women due to the lack of concern nurses tend to have when hearing their symptoms. More recently, another Twitter user tweeted about her friend who died because of pregnancy complications that were reported to her doctor but were ignored.
Surgeons really won't see patients because of Medicaid, because they'll perform a surgery, but they end up paying for the surgery. The doctor does, because they lose money for operating on Medicaid patients. So sometimes there's a limit in doctors' offices on how many Medicaid or Medicare patients that they can have because of that, which is not okay.
It goes back to slavery. During slavery, African American was not considered a person. They were considered livestock. There was abuse, killing, beating, rape of African American women. There was no recourse because they were not considered a person. They were considered livestock. Even before the Tuskegee study, African Americans were used as guinea pigs to perfect medical procedures before using them on the white race.
The Tuskegee syphilis study was a 40-year study in which treatment for syphilis was withheld from 399 African American sharecroppers while being told they were receiving free health care. When the smallpox made its way to the U.S., vaccines for the virus were tested on slaves. Slave women were commonly used for surgical experiments. The surgery for C-sections was perfected on African American women. In the 19th century, medical students turned to robbing the graves of deceased African Americans for medical practice. Because of an incorrect report citing the presence of sickle cell disease in 2 million African Americans, screening was required for children and prisoners of African American descent. Discriminatory employment practices were prevalent against those identified as carrying the disease. The sterilization plan in the 70s was an attempt to reduce the passage of poverty generation after generation. The plan was disguised as family planning and tricked many African American women into sterilization after having C-sections. Some were also tricked into sterilizing their teenage daughters. The Harvard T.H. Chan School of Public Health designed a telephone survey in which 802 African American adults and 902 Caucasian adults were asked a series of questions to examine racial discrimination against African American adults. 32% of Black participants said they experienced discrimination when going to a doctor. Only 5% of white participants said the same. 22% of Black participants said they avoided seeking out health care in fear of being discriminated against or receiving poor treatment. 3% of white participants said the same.
Your health providers may not be culturally competent. They don't always understand patient education information. So in many cases, they don't ask them to explain it more in detail. And sometimes health providers, especially physicians, may not be as sensitive as the advanced practice nurse in educating their patients on patient education and being culturally sensitive to that particular population. African Americans have to be empowered to be an advocate for themselves. Technology has brought a lot of knowledge. You can go and look up information yourself and question. We must be advocates. We must be knowledgeable. We all need to come together in terms of transformation development to improve the African American community.